I am a pulmonary critical care physician, so that means I have two specialties. I'm a pulmonologist, so I work with lung health, and I also work in the intensive care unit taking care of critically ill patients. So COPD is very interesting in that it has many different causes. Most commonly here in the United States, the cause is going to be tobacco use, tobacco of all kinds, including inhalants like the e-cigarettes and things like that. But it can also have secondary tobacco use, so people who lived in homes where their parents or grandparents smoked will also have a risk for COPD. Environmental exposures, so heavy pollutants in the air where there's smog and things like that, so if you live in big urban areas. And actually worldwide, the most common risk factor is open cooking fires. There is a small population whose risk factor is genetic, so they lack an enzyme called alpha-1 antitrypsin. So once you get diagnosed with COPD, we determine how symptomatic you are. What kind of symptoms are you having? So are you having symptoms every day? If you're not having symptoms every day, we may give you treatment that you can use when you are symptomatic, but not when you're not. If you're having symptoms every day, we put you on a chronic inhaled therapy, so medications that you take every day to help with your breathing. And then we monitor. Is your COPD advancing? If it is, why? Is it because you're continuing to smoke? Is it environmental factors? What can we do to help you prevent that progression of disease? And then we also do other additive things. For example, birds of a feather run together. So if you are a smoker, you have higher risk for lung disease. You also have higher risk for heart disease. Make sure those patients with COPD get appropriate heart screening, get appropriate cancer screening, because again, COPD is going to put you at higher risk for lung cancer. So it's not just treating that one disease. Those of us who treat COPD need to keep our eye out on the other associated diseases. We don't understand how much smoking impairs our health, and it's not just lung health. It impairs, it increases your risk for heart disease. It increases your risk for 15 different kinds of cancer. Everybody always says smoking, lung cancer. There's 14 other ones that are increased risk significantly by tobacco use. Also, there was a study done once that basically estimated that for every cigarette you smoke, you can basically take 7 minutes off your life. So if I could give patients back all that time at the end of their life when they're dying of their COPD or their lung cancer or their heart disease, that would be my gift to them.